Hey guys, this is Dr. Greg with Medical Muscle. And in this video, I want to talk about the things you can do day one to really shine in clinicals, specifically third year. It is the most important year of your medical school career, hands down, okay? So the best thing you can do in the first week, first few days, seriously, first day, talk with one of the residents, talk with an attending, anybody you feel comfortable with, and ask them how they want the material presented to them, okay? All right, so get a whole list of all the things that they want you to ask the patient. On the day that you go and see patients, get a piece of paper and write all this out and write everything that the patient said, all their labs, anything that fits with what you need to present. It's a huge, I want to say, cheat code if you can read off your paper. No one expects you to say anything from memory, okay? It's okay to have a little cheat sheet. That's fine. So use it, okay? It'll help you a lot keeping your information organized, keeping it concise, because remember, doctors are very busy. They have a lot of patients. So if you can go through this quick, present the pertinent stuff, then you've just made everybody's life easier and you were helpful. Okay, the next one is you want to study as much as you can of the important things that you will have to know right off the bat, okay? Just like the main meat and potatoes of the specialty. Like, just for example, OBGYN. It's really important to understand fetal heart tracings. That's a very important thing to know. You're knowing if the fetus is in distress or not, okay? Before the rotation started in OBGYN, I watched a video on fetal heart tracings. I just skimmed it. I just watched it just to understand, what you're looking for, how to describe things, what's average, right? All those things are important. And it just so happened that one of the head residents decided to pimp me on that exact information. And guess what? Guess who knew all that stuff? Okay, now, but here's my next point, and I feel like this is not discussed enough, okay, is that you don't want to outshine the master, okay? This is something I learned from Robert Greene, The 48 Laws of Power, right? Great book. You don't want to look too smart, okay? Many residents or attendings have egos, right? And if you are showing off a little too much, it can actually hurt you. It's a weird psychology. It's just human nature. So when asked some questions, you want to just be brief, give the most pertinent stuff, and then maybe hold back some of that desire to show off, okay? Really important. The other downside is if you talk too much, you're giving the attending or the resident more opportunities to pick apart something that you said incorrectly and make it a point that you were an idiot in front of everybody, okay? So don't have that happen. Be concise and, don't stick out. That's a big thing too. Here's the next part. Medical school is kind of competitive, right? Just by default, it is. You're dealing with a lot of big egos. All of us who go into medicine are very smart, very driven people. And we all kind of want to be the best, right? We want to be the smartest person in the room. Everybody wants that. In clinicals, you have to let that go. It is a hindrance to your own personal gain. You have to work as a team. Even if you don't like the person, even if you just despise them. I know people who had to work with people who they didn't like, and they were not able to work together, and just their rotations were miserable. There's personalities that you just don't get along with. That's fine, okay, whatever. And sometimes you're just forced to work with certain people. Just do your best just to be friendly and helpful, and just make the life of this other person easier, because it's going to be reciprocal, okay? They're going to share stuff with you. They're going to help you, because sometimes residents will tell only one of you, okay? And if you guys are friendly, then you guys are helping each other out, right? So don't create enemies. This is not the time to do it. Your three will just tear you apart if that's the case. Anybody who I knew who had any problems with anybody, they had a lot of struggles, okay? So be friendly, work as a team, okay? It's very important. Now, here's my last point, and I think this is extremely helpful for you as a student, okay? Study the material, like UWorld material, early and get a lot of volume in, okay? Work really hard, because there's going to be situations where there's something happening with a patient and everybody is kind of like, I'm not sure, the residents, the attending, they're like all trying to figure out what's going on. It's some weird case. If maybe you've seen it in a question, it's some weird situation, it's rare. If you can bring it up as a potential differential, it can help a lot. If that's actually what's going on, then, you've definitely saved people a lot of time and you've helped the patients, right? Something really important is that you should have up-to-date or some kind of like medical app that you can quickly look up things, okay? Up-to-date is great. You can look up symptoms, very helpful. If you're on rounds and you have a little time, you have time to search something, it's just really helpful, and I think that's a big thing for a student is you need to be helpful, and you don't always have to, be the Dr. House where you're able to figure out these weird things. No, that's not the only thing you need to be able to do. Pushing patients to imaging. Okay, getting patients to imaging. I did that in the emergency room. Everybody thought that was super helpful when we didn't have the people to do that. Getting patients water. Going back and talking with the patient. Okay, checking in on the patients. Being consistent, getting to the hospital on time. Getting there a little early. Being ready. Okay, having everything ready. Seeing your patients in the morning. Getting all the information. Just being a good worker will make everybody like you a lot more, okay? Those are just some really basic things that helped me a lot, and I think they'll help you guys a lot too, okay? Well, I wish you guys the best of luck. Any of you who are going into year 3, or maybe even year 4, it's still important. And yeah, wish you guys the best of luck.